So ready. So good afternoon, everybody. This is Paula with Leading Age Virginia. Thank you so much for being on this webinar, How to Stay Physically and Mentally Healthy During COVID Isolation. Our two speakers today are Melissa Ward and Karen Welsh with Functional Pathways. So I am just going to turn it over to them and let them give you all the great information.
All right, thank you so much, Paula, and thanks everybody for joining us today. We really appreciate the opportunity to be a part of this part of your day with you. You know, lots of things going on in the world right now and places we've never thought we would be. And, you know, what we're going to talk about today is, you know, how to stay healthy, not only physically, you know, but mentally during this isolation period. Because of the industry we're in and serving older adults, a lot of the focus of the presentation is how do we keep residents engaged? But as you're listening and looking at the slides, I want you to keep in mind that these activities, I think it's important that we all stay engaged physically and mentally. So while the presentation is focused on residents a lot, but I want you to be thinking about your coworkers, the staff, you know, even your family members. How are things that we talk about today just as important for all of us? Because if we're not physically and mentally healthy, it's hard for us to stand up and be there for our residents and for our families. So kind of keep that in mind, you know, as we go through the information. There's been some things, you know, that have become the new norms for us. You know, when did we think that this was going to be, you know, our new look? And this is what we're dealing with. We're in healthcare environments, and, you know, this is what people are seeing. They're wearing this themselves. And so it really kind of changes a lot of the dynamics. So how do we continue to live where we're at right now and stay engaged? So before we get started, I want to talk a little bit more about social isolation. I think that's one of those terms that has become quite common in our society at this point. And that's where we're going to focus, is social isolation. But I also want to talk just a second about loneliness. And kind of the difference between the two and how they play off of each other. When we think about loneliness, it's more of a subjective feeling, and it's based on the own person's subjective feeling between the gap between what is their desired level of social contact and then what is the reality, what is the actual social contact that they're receiving. And so loneliness becomes the gap between the two, and it varies for every person. Some people can be more isolated and that they like that. Other people need high contact, and if they're not getting that, that can cause, you know, their perceived issues of their relationship. Typically, loneliness is never a feeling that people seek out. And once somebody gets lonely, it can be difficult to kind of pull them out of that. And with the additional stressors we have going on right now, you know, we really have to keep into consideration the impact on loneliness as well. The flip side of loneliness, you know, so we've got the subjective loneliness. Social isolation is going to be your objective measure. So that's going to be the measure of the number of contacts people have. So it's more about the quantity versus the quality. So if you think about it, you know, some people may choose to have a small number of contacts and they're happy with that. Other people prefer a high number of contacts, and so that's kind of when you think about the two. When someone feels socially isolated, you know, this can be overcome by increasing the number and the interactions that they have. And we have a lot of restraints with social distancing, safer at home, people isolating to their rooms. And what we hope to cover today is how we can increase those that quantity of contact to help stave off social isolation and hopefully loneliness. And then, so when we think about how are they linked, you know, we know they're different, but we know that isolation can lead to loneliness, and then loneliness can also lead people to self-isolate, and they can both occur at the same time. So let's go ahead and we'll start getting into, you know, the presentation. And talk about some specifics. I think one thing I did want to mention too, related to social isolation and loneliness, you know, are also we're seeing some increased anxiety, uncertainty, you know, some new and worsening depression, and just kind of thinking about, you know, making sure that we're involving social work is highly involved. We're bringing in mental health professionals as needed, and that we're really attending to those areas. I know from a rehab perspective, studies have shown people that are suffering with, mental health, they're struggling with mental health. If they're in a rehab program, the mental health complications and comorbidities can interfere with their rehabilitation. And so I think that probably spills out to a lot of other things in their life. So we want to make sure that that becomes, a part of that consideration. So how do we keep people engaged? And, we're going to talk about, our background as therapists, but also we have a lot of experience in wellness and working with our activities coordinators, our social workers. And how do we keep people engaged? Now, when we think about therapy services, in the beginning, I had a lot of therapists coming to me asking, am I essential? And the answer to that from a therapy perspective is absolutely, therapy is essential. We're a key part of their care plan, and as well as sometimes when they're in a skilled unit, it can be the reason why they're there. So it's important that, we know people are isolating, they're more sedentary, in older adults. That can set them up for acceleration in decline in function. So the coordination, whether you're skilled, AL, IL, the communication and coordination between departments is really vital. And I think we've really seen, I think it's been kind of really nice to see all the collaboration and things that people, really have done to come together so that we can, minimize these negative impacts, on the residents. And, with that, empowering everyone to be the eyes and ears. We're looking at preserving PPE, reducing the amount of people that are going in and out of the room. So anybody that has touch with that resident, we need to make it the most valuable contact every single time, regardless of what department. Environmental services, if you have nursing staff going in, we want to make sure we're the eyes and the ears and that we're referring to other departments as well. The other thing, kind of thinking that we've had to do, speaking from a therapy perspective, is we're having to do treatments. We don't have the gym. Sometimes we're having to do in-room treatments or treatments confined to certain areas, and really thinking outside of the gym and challenging our therapists to be innovative. And I think that goes for all departments. How do we challenge ourselves to think out of the norm and be creative and really keep ourselves and the residents engaged? So what we'll do is we'll kind of transition into some of those activities and have some discussions around that. I am going to turn this over to my colleague, speech language pathologist and director of clinical outcomes for functional pathways, Karen Welsh.
Thanks, Melissa. Hi, everybody. First, I just want to say thanks for what you guys are all doing on a daily basis to take care of each other, take care of the residents and patients in your care, and the families that are certainly out there looking for communication with those residents in our facilities. I know it's a challenging time, but I am amazed on an hourly basis of everything that people are doing to be creative and to keep our residents engaged, to keep them active, to keep each other active, and the creativity that just has really flown out there. So some of the things that we're going to do today is really just share some of those ideas that we've seen that have been effective for our facilities and clients that we work with, and some of the things that we've heard in the industry. This is not an all-inclusive list, and the list grows every single day. You can go onto YouTube or Facebook or whatever social media outlet you use to be able to see the different ideas, but these are just some of the ones that we've seen. And this is not just for our residents and our patients. As Melissa said earlier, it's really about what can we do across the board in neighborhoods. We see people out on their driveways, cooking out at the end of their driveways just to be able to talk to each other. And we know as we start opening up, some of those things are going to change. But for us in the post-acute world, we're probably not going to open up quite as quickly, and our ability to be able to have people in our buildings and things like that and contact is probably not going to change as quickly as everybody else. So we still need to be able to keep that creativity flowing. and make sure that we're engaging our residents and ourselves both physically and mentally. So we'll talk a little bit first about the staying in motion. Again, these are just a couple of ideas that our teams have come up with that we've seen used in our buildings. One of the things was creating a mobile gardening activity. The activities department and the therapy department work together. And we certainly see that therapy can be involved in all of these activities from a balance perspective, ADLs, upper extremity, range of motion, all of those kind of things. Therapy can certainly be your point of service from a creativity perspective and coming up with new ideas to keep the residents and patients moving. So doing that mobile gardening, have each resident plant their own plant or herb or whatever it is and move it down the hallway. And then some of our facilities have planted them outside in the courtyard so the patients can see those. Certainly creative from that perspective. Look at your ways to promote self-feeding for your residents. Since we are no longer able to have our residents in dining areas, we have some patients that require that stimulation really in that visualization from other residents and staff to be able to continue to be able to feed themselves and to want to eat. We know that meals tend to be a very social time for people and in their families and in everything that we do. So being able to continue that is important. Some of the things that we've suggested is having residents eat in their doorways. And that way they can see another resident from across the hallway. That's assuming that your hallways are 6 feet wide. We know we have some older facilities that don't necessarily meet that requirement in some cases, but being able to at least see somebody else or turn their television off of the news for a little while, which would probably be refreshing to most, and put it onto the Food Network or another channel that might have people eating or enjoying food or cooking or something like that during that meal, so it kind of stimulates that as well. The other piece around self-feeding and mealtime is making sure that if you're using disposable food containers and utensils, that the residents and patients are able to see the food in those containers. We know that patients that have cognitive decline or any kind of dementia can lose that depth perception and that ability to tell the difference and contrast between the mashed potatoes and the white disposable food container. So some facilities have actually taken markers and outlined each section of those disposable food containers or put a mark on those white plastic disposable utensils so they can at least see them and be able to at least tell that there's something in each of the different sections. The next item that I thought was incredibly creative and we've had a lot of our facilities start utilizing is working with the therapy department to determine which residents are safe to use their walkers or their assistive device, whether it's a walker or a rollator or cane. And marking those devices, green, yellow, or red, or whatever color you may decide to use, to indicate the level of skill that the patient has using those assistive devices. For green, if you look in the room and somebody's up walking around and their walker has green tape on it, we know they're good. You probably don't have to run in there and do anything with them. They don't need assistance. If it's yellow, they need some supervision. You may still not have to go in the room, but at least keep an eye on them and keep that walker out of the resident's reach. And then red, because of the isolation and the infection control, we know that certain walkers are having to stay in the room, so you're not having to cleanse them between patients. But keeping that red walker out of the resident's way, put it in their closet or in the bathroom or something like that. And if a staff member walks past the room and sees a patient with a red on their walker, they probably need to get in that room pretty quickly because they're not supposed to be up moving around. So it's just a nice little visual for the staff and anybody else that is walking past the resident rooms to be able to see who's safe and who's not and hopefully reduce those falls. Because we know that with this social isolation, there's certainly an increased risk for falls because we don't have as many touches with our patients. You could also work with your residents to spring clean their rooms, wash the windows. Therapy, I know I've seen some pictures and had conversations with some therapists that have helped clean out their drawers and sort things and just kind of clean things out in general and reorganize. some stuff that's great for balance, it's great for exercise, it's great for cognition and stimulation as well, just to keep them up and moving. Chair Tai Chi and yoga, chair yoga. There are multiple videos on YouTube out there that you can go out and get for free to be able to do with those residents. You could have them sitting in their doorways and somebody can be leading that chair Tai Chi and yoga for the residents sitting in their doorways. Therapy can certainly participate in that as well. It's great for balance. It's great for core and trunk rotation and strength to be able to reduce those falls as well. One of the coolest things I've seen is a hallway hockey game and Hungry Hungry Hippo. I don't know if you guys saw that video that came out when COVID isolation first came out in the nursing homes, but being able to have those pool noodles or whatever it is, be able to hit a balloon or a softball or something like that up and down the hallway and keep score based on sides of the hall or whatever, just to be able to keep them up and moving. I've seen staff get really highly involved in that and have a great time and a lot of fun. And it's fun for the residents too. And that's true for all of these activities, really having the staff be involved in these and be engaged, and they have just as much fun, if not more, than the residents in some cases. So just using those hallway games as well. Next slide.
Sure, and I'll just kind of, Karen, before we go to the next slide, just, sort of add in, Karen was talking about, Tai Chi and all of those different things. And I think some of the things to think about with that is, when we're doing these exercises and encouraging residents, is it's not about being perfect, it's about trying and just moving. And studies have also shown that movement in general, just general movement, moving to music, just moving around, has a positive impact. It can help with cognitive, it can help stimulate people with cognitive issues. And it's also been shown that movement is helpful for helping with depression. And specifically kind of yoga has been cited. So, there's chair yoga as well. It's really just about getting people, to move. And like Karen said, there's so many resources out there as well on YouTube. And we've had some people that have closed caption TVs, play some of those videos, and those that want to participate log in at the different times and participate.
Great. Just some other ideas around staying in motion, and you can have the residents participate in this whether they're sitting or standing. Some of these are more brain stimulation. Others, you can have them standing at their bedside table or standing at the countertop in their room, whatever it is. But doing a communal quilt, having them create their own little small swatch of cloth, and then have someone, potentially a resident. I know in one of our facilities we have a resident that was a seamstress, so she put all the patches together and made the quilt, and they hang it in the common area when people come and go in the facility, which has been really cool for them to be able to share that. Same thing with the communal collage or a mural. Have everybody participate in that. You can have competitions between the wings, you can have competitions between floors, you can have competition between staff and patients, or certain areas of staff and patients together against another area of staff and patients. Just getting everybody involved. And from a therapy perspective, when I look at the collage and the quilt and the mural, I mean, it almost makes my mouth water thinking about all of the activities that we can do from a therapeutic perspective for both PT, OT, all three, PT, OT, and speech, from a problem solving, reasoning, sequencing, standing balance, sitting balance, upper extremity exercise. All of those things are things that we can certainly help the patient with in participating in these activities. But also, again, great fun for the staff as well. Scavenger hunt, I think, is a really cool idea. They would, we had a couple of facilities that would have a list that they would hand to their patients and say, okay, whoever finds all these things first, or whoever finds this certain list first wins a prize, announcing them overhead. The staff can help the resident find those things in their rooms or in the facility. You can do it as a small group or facility-wide, and just something to have people up and moving around. Now, obviously, you have to be careful for those residents that have the red walkers, that you don't necessarily want up and grooving, but hopefully they're in a wheelchair, or you can have a staff member that can assist with that as well. Creating handmade cards, we've seen tons of information about that out on social media about different people making cards for different people in the community making cards for our residents making cards for staff. But again, it's another stimulation that keeps them moving, even if it's just moving their arm back and forth to get the pencils out and drawing on a piece of paper, and stimulating their brain as well. We talked about hallway hockey game. I think we had that on there twice because it was so fun. The next piece, and again, there's so many different things that you can do about staying in motion. When you talk about, I think in the next slide, we talk about name that tune and singing out loud and doing some other things that keep the resident active. What can you do in the hallways? What can you do in the doorways? Having patients read to each other. I think I have that on the slide as well. But be sure when whatever activity that you're doing with your residents, that you're making sure that you're taking into consideration their cognitive level. If you have not done a cognitive level on your residents, whether it's by the GDS or the slums or TIPA Snow, GEMS, whatever system you use, you want to be careful to make sure that the activities that you're asking the residents to participate in are appropriate for their cognitive level, because it'll cause frustration and potentially anxiety and anger if it keeps them, if it bores them, or if it's too hard for them to be able to participate. So always keep that in mind. And I think sometimes we assume that our residents who are cognitively intact, they're all good. This isn't necessarily going to affect them as much as everybody else. I can tell you from her firsthand experience, my parents, who are getting ready to be 80, both, my mother especially, very cognitively intact. She's going insane, not being able to be out and about and doing her volunteer stuff and blow and go as she wants to. So it's definitely affecting her. So I actually sent her a bunch of coloring books that are geared, that have the mandalas, and they're a little harder than the kid ones. And she has just gone to town on those things. She's probably done 36 different ones, and they're amazing. I think they could probably hang in an art gallery somewhere, and I realize I'm probably biased, but she needs that stimulation. And she has verbalized that it's been very calming for her, and it really focuses her thought, and it's reduced her anxiety about everything that's going on. So, even if it's something that you think is relatively simple or something, oh, I don't know that they would do that, certainly give it a go. And I think the results have been much more positive in some cases than we thought they ever would be. Again, I want to talk a little bit about meal presentation and that contrast. We know that since our residents don't have staff in the rooms all the time to help them with the meals, and they're not in the dining rooms, please make sure that you're doing that assessment of how much are they really eating, and looking at the food vessel and making sure that there is a contrast between the food and what the food comes in, and that they can distinguish that food, and also that they're being stimulated during that meal to be able to eat. There's some interesting things on Pinterest and I think Etsy and YouTube about creating activity boxes that are specific for certain populations and even resident specific. You can involve your family members and friends of the residents to be able to say, okay, well, what kind of things did your loved one like? Can you bring some things? We can certainly sanitize most of that, I would guess, that we could bring in and have that resident be engaged and be able to communicate about whether it's pictures or a hobby or whatever it is, just to keep them engaged. We've also included on here a couple of websites that are available for free to be able to keep your brain active. Word Crossing, Mind Games, Lumosity, and AARP has an amazing free game app that you can download multiple different games, whether it's Mahjong or Solitaire or word crossword puzzles. I forget how many games are on there, but it's all for free. And they can use their device, if they have them, to be able to access those as well. Lumosity is a great thing for memory and problem solving, reasoning. I use it on a daily basis. I think it's pretty cool and stimulating to be able to use that as well. So again, this is not an all-inclusive list, but just a couple of the websites that we have found to be to be free and also to be easily accessible and easily usable by our residents. Some other items, and some of these I kind of mentioned, I think, a little bit before, but trivia. Do trivia overhead in your facilities and have a little contest and make it period appropriate. Make sure, I know if I ask my dad to tell me who the most popular singer is right now, he's not going to know. He's going to say, you know, Elvis Presley or Engelbert Humperdinck and whoever it is, but make sure that it's age appropriate for the residents that you're talking about when you do your trivia. And it's really quite fascinating. It's interesting for the staff too, especially when you're asking past history items, what we learn from some of that as well, and the stories that have come out of some of that, and be able to ask some different questions of the residents. And do it for both your staff and for your residents as well. Have the resident read to their roommate, have the family come and be able to read through the window or talk through the window with their roommate as well, just to be able to stay engaged. Encourage those families to provide any information that are going to foster good memories and meaningful conversations and help them feel a little bit more connected. I know one of the cool things that I actually got to be a part of was I had a resident that she and her son had beer and pizza every Thursday, non-alcoholic beer, I'll preface that. But every Thursday he would bring pizza and their non-alcoholic Heineken Dark, and they would sit and have beer and pizza together every Thursday. So what he did was he brought the pizza and the beer for her, and he sat outside the window, and they shared their beer and pizza through the window, and it was just like old times, and she didn't know any different and had a blast, and it was a really great thing. So encourage that sharing of time as well. I've seen lots of different things as far as playing tic-tac-toe on the windows or playing Scrabble through the window. I saw one the other day about Yahtzee. They played it virtually. They played Yahtzee virtually. The daughter had a Yahtzee thing and the patient had Yahtzee, and they encouraged each to take turns and do all that. So it was just a way to interact as well. I'd already talked about the mealtime piece, putting on a Food Network channel, any kind of cooking channel or something like that to just kind of stimulate the appetite. We talked a little bit before also about writing cards and notes and things like that. Have other residents as pen pals throughout the facility. Have somebody, you know, one wing to be pen pals with another wing and share information back and forth. And another really good access point, especially for our residents that are higher cognitively intact, is TED Talks. Any possible topic or learning idea or anything that you want to know about is available on TED Talks. There's some really cool things on TED Talks about staying mentally healthy. There's a lot of psychological things out there that are really good for support, but there's also things that you can learn about science or history or languages or anything like that just to stay stimulated. And it's free, so that's good as well. Next. And this is our last slide for today, and just some final thoughts around socializing while distancing and some other activities that you can perform with each other, with your families, with the staff and patients as well. The first one is about creating a community story. And that's really about, it's almost like Whisper Down the Lane, except instead of trying to figure out if you said the same thing at the beginning as you said at the end, it's really about having the staff and the residents add their sentence to the story and see how far you can go and how many times you can go around and create your own community story, and then read it out overhead or publish it or put it at the front. And it'll be something really cool to be able to share once we're able to come out of social isolation as well, and share it with the family, share it with customers and vendors and things like that. Talk about using volunteers in the community. There are a lot of people out there that would love to talk to some of our residents and just have a little social visit and wellness visit by phone, where they can call and chat or read to them over the phone, or read a magazine article, or play some music or sing. Any of those kind of things are certainly able to be done and provide that socialization for our residents to keep them from feeling isolated. Have them sit in their doorways and do a sing-along. I've seen numerous videos of that, of singing along to tunes that they know. playing Name That Tune. Again, keep in mind the period of time that you're talking about for music. Although I did have a resident a couple months ago surprise me when I said who's her favorite artist, and she was 84 years old and she said Lady Gaga, and I about fell on the floor. But I thought that was pretty cool. So you never know, but still you want to make sure that it's period specific. Play some music overhead. Melissa mentioned earlier, even if you're just swaying to a tune or dancing to a tune, have them talk about, reminisce about music, but playing that music overhead. And music that makes sense to those residents. I know it might not necessarily be the music that all the staff listens to, but we need to make sure that the residents are stimulated as well. Have family members outside the windows. I kind of talked about that a little bit earlier. And one of the things I thought was really cool with our team was the initiative of no iPhone left uncharged or no electronics left uncharged. And really having your staff engaged in making sure that the phone or iPad or whatever it is that the residents have are fully charged, and that they have the ability to continue to do that, and that they remember to do that. Because if they need to get a call from their family or they want to call them and the phone's not charged, that increases anxiety, it causes depression, all those kind of things. So just making sure that staff's engaged and just checking that before they leave the room and making sure that they have access to those kind of things. So those are kind of some of our ideas. Do you guys have, I'd like to open it up, and do you guys have some other additional creative things that you've been doing in your communities? Things that kind of have sparked an idea or anything you'd like to share? I think you're all muted, so you would have to unmute yourself or put it in the chat box.
We have such a quiet group today.
Hey, definitely encourage creativity. And I think the key is don't say no to a suggestion until you've fully vetted it out, because it could be something that could be really neat for your residents and really keep them engaged, and also motivate your staff as well, because I think they've been, therapists by nature tend to be pretty creative. I think activities and social services and nurses are as well in some way, shape, or form, especially in the environment that we work in. So encourage that creativity, use it. Take those ideas, run with them. Don't be afraid to try different things. And I know with use of PPE and face masks and things like that, it makes it a little challenging, but we can definitely do it. And I think beyond COVID, we are all going to be better, more creative, more practicing at the top of our license, therapists, nurses, administrators, DONs, whatever we are. This is going to make us better and stronger and more creative than anything that we've ever experienced before. So I just encourage you to continue that creativity and share with each other. It's not about, for me, even though I work for Functional Pathways, I love working for Functional Pathways. In times like these, it's not just about Functional Pathways, it's about how all of us together can get through this and be stronger and learn what we have to learn and make patient care better every single day. Melissa, anything you want to follow up with?
Nope, I thought you really summed it up well. We're all in this together.
Well, Karen and Melissa, I appreciate you so much. Thank you for these great ideas. I'm sure our communities can certainly use some of them. And is there anything more for like independent living, those more high functioning, that you can think of that they might be able to utilize?
I think certainly the websites are good. Some of our communities have sent out to their independent living residents the exercise of the day, or the song for the day, or learn a dance for the day. Just something that they can do daily, just to do something new and novel, potentially, that they haven't done before. But certainly the exercise of the day, or the group of exercises. Today we're going to do your biceps and triceps, and here's the 3 exercises that you should do. this many reps on the, if you're, of course there's a disclaimer that you can send with that, but just to keep them stimulated. But certainly doing the, we have something that we created at Functional Pathways called Cognitive Calisthenics, and it lists about 2 or 3 pages different activities that can be done for any range, including, and we break it out into different cognitive levels. So the ones that are more independent, what they can participate in. So just make sure you're taking that cognitive level into consideration as well. But certainly staying connected. TED Talks I've found has been a great resource for our residents who are living in independent living, even assisted living. My mother has gotten addicted to TED Talks, and I think if she sends me one more recommendation of things I'm gonna need to watch, I'm gonna need to retire tomorrow to get them all done. But it's been great for her and several of my other family members as well. So just a cool resource.
All right, and that's either for men or women, doesn't matter, right?
Correct.
All right, well, thank you so much.
Yeah. I was going to say just one more thing. There's a lot of organizations that are offering, whether it's free, online yoga. And if you just kind of Google freebies or things, there's so many things out there right now. There's actually an organization that is doing virtual pet visits where you schedule an appointment and they have cats, dogs, goats, ducks. And I thought you'd only get to visit with one, but we had a therapist schedule an appointment for her and one of her patients, and she said it was absolutely awesome and amazing. They spent 30 minutes, and they got to show each other the animals. The resident was able to show her environment, and at the end of it, they were singing Amazing Grace, and the dog was singing along with it. So there's a lot of things out there in organizations really trying to pitch in for activities and things for older adults during this time. So just, encourage you guys to kind of Google and seek out. There's also a lot of things for frontline healthcare workers that I think you can share with your staff to help them as well, mentally and physically. For providers, for example, that have an NPI number, Headspace is a meditation kind of relaxation app. Usually costs like $70 a year. They're giving NPI providers that free, I believe, through the end of the year. So I think there's things that we can also share with our more independent residents as well as our employees. And some of the biggest smiles and happiness that I've seen come along are the faces of the employees engaging in something that's bringing joy to the resident. So, I think that's an opportunity for us to bring joy to our coworkers as well.
That's so true. All right, again, thank you so much, and thank you all for being on the call. I'm just going to end this now. Thanks.